So I did a deep dive on this article with exercise and the non-pharmacological treatments of POTS, which if you have EDS or you're long haul COVID and you feel like you're kind of woozy and pass out and you get some heart palpitations, you might have POTS, just so you know. So in general, exercise helps regulate your nervous system, and adding electrolytes to your beverages helps because that matters with POTS, but it doesn't control all POTS. So reductions in plasma and blood volume has also been reported in many POTS patients. So sometimes POTS is not simple, okay? Some people with POTS have a smaller heart, so the smaller heart coupled with a reduced blood volume results in a large fall in the stroke volume, okay? So people with POTS might have a smaller heart and they have less blood volume. So then they can have an excessive increase in the heart rate. So this reflex tachycardia can happen. So this is why maybe electrolytes doesn't help all people with POTS. Now, this particular article does go on to say, since POTS is fundamentally a condition dependent on gravity, clues regarding the etiology of POTS can be found in research studying the spaceflight and its ground-based analog bed rest deconditioning. So some people with POTS might have POTS because they have a smaller heart. Some people might have POTS because they were on bed rest due to long-haul COVID because the deconditioning was so huge. Other things that people with POTS have been using as treatments, and I will tell you, this is a big time winner in the POTS community, is more importantly, these people, they will probably take beta blockers. Beta blockers, they're real helpful for POTS. So this article spells out a specific exercise program for people with POTS, because if we can strengthen your tiny little heart and help strengthen the muscles to support the blood vessels, that perhaps this endurance training can help push blood back to your tiny heart. Now, people with EDS and POTS, well, you know, usually these people have hypermobility and joint stability, and these complications and widespread musculoskeletal pain, and well, it can limit their exercise capacity. Patients should start with a non-weight bearing exercise such as swimming or rowing at a mild intensity. My favorite line of this article is what you can start doing if you have POTS, EDS with POTS, and the way you start training is the key is first to start with a horizontal mode of training. It's true. The main big takeaway from using exercise to treat POTS, especially even in patients with hypermobility, they found in this particular study, they said in our experience, they being the patient, should be encouraged to persevere and be reassured that exercise is not harming them, even though they find it uncomfortable. But be safe, my friends. Hit the plus sign and follow for more women's health and wellness tips. Bye.